Welcome to this patient education video from the Cervical Spine Research Society. I'm Dr. Alexander Satin, and joining me today is Dr. John Heller, a cervical spine specialist from Emory University and former president of the Cervical Spine Research Society. Dr. Heller, thank you so much for joining us.
Thank you. It's my pleasure. Neck pain is something we see every day in practice, and I think it's incredibly important that patients have access to clear, reliable information.
Exactly. If you're watching this, chances are you're looking for answers about neck pain. Today, Dr. Heller is going to walk us through some of the most common questions that patients ask us about neck pain. What causes neck pain? How is it diagnosed? And what are my treatment options? Let's get into it. Just how common is neck pain? Is this something to be worried about?
Neck pain is actually one of the most common conditions we see. Studies show that it affects more than 30% of the general population every year, making it the fourth leading cause of disability, right behind lower back pain, depression, and joint pains. About half of all people will experience a significant episode of neck pain at some point in their lives. So if you're dealing with it, you are definitely not alone.
Dr. Heller, who tends to get neck pain? Is it random, or are some people more at risk than others?
Neck pain is more common in women than men, and it tends to peak during middle age. People who have other muscle and bone conditions can be more likely to experience it. Specific risk factors may include trauma like whiplash and certain contact sports. That said, plenty of people develop neck pain with none of these risk factors, so it can really affect anyone.
What actually causes neck pain? There seems to be so many possibilities.
Good question, and you're right. There are many different causes. The most common one is what we call mechanical neck pain, which comes from the actual structures in your spine, like the discs between your vertebra or the small facet joints in the back of your neck. When these degenerate or wear down over time, they can be a source of pain. The cervical spine is surrounded by a complex network of muscles and ligaments that are also critical for normal movement and posture. As a result, muscle and ligament strains are another very common source. It's completely normal for everyone to show some signs of disc or joint wear on an X-ray or MRI as we age. Just because something looks worn on an image does not mean it's the source of your pain. We always have to interpret imaging in the context of your age, symptoms, and physical examination. Another cause is compression of nerve structures, either the spinal cord or the nerve roots that branch from it. This type of neck pain is often, though not always, accompanied by other symptoms like pain radiating into the arm, numbness, tingling, or weakness.
How long does neck pain usually last? Will it go away on its own?
Duration is actually one of the more useful pieces of information we have, because it helps us predict how things are going to go over the long term. We can categorize pain into three phases: acute, which is less than 6 weeks, subacute, which is less than 3 months, and chronic, which is more than 3 months. The shorter the duration, generally, the better the outlook. Most cases of acute neck pain, the kind that comes on suddenly, will improve significantly within about 2 months. So for many people, this does get better on its own with conservative care.
When do you recommend that someone see a doctor for neck pain, and what should they expect?
Well, your doctor will start by taking a thorough history, asking you about when your pain started, what its character is, where's it located, what makes it better or worse, whether it travels into your arms, and whether you have any numbness, weakness, or even balance problems. That conversation alone gives us a tremendous amount of information. Then comes a detailed physical and neurological examination to look for any signs that the nerves might be involved. Based on all of that, then we can decide whether any additional testing is needed.
When do you typically order an X-ray or an MRI?
This is one of the most common questions we get. The honest answer is not always. Not every case of neck pain requires an MRI or a CT scan, and even when imaging is appropriate, Different situations call for different types of imaging. The idea is to use resources wisely. X-rays are a good start. They can identify disc degeneration, bone spurs, facet joint arthritis, fractures, ligament injuries, and issues with alignment of the spine like kyphosis. Special X-rays taken while bending the neck forward and backward can also reveal abnormal movement or instability patterns. MRI is the go-to when we're concerned about nerve compression. If you have arm pain, numbness, weakness, or gait imbalance, an MRI helps us see the soft tissues, discs, and nerves in detail. CT scans, on the other hand, give us more detail about bone anatomy, but they do involve radiation, so we tend to reserve those for specific situations. If your pain is isolated to the neck with no neurologic symptoms and relatively new, holding off on MRI or CT imaging is often the right call. Not because we're dismissing your pain, but because imaging early on rarely changes the initial treatment plan.
What happens if the imaging doesn't show a clear cause for neck pain?
That's actually common. If symptoms haven't improved with time and basic treatment, we may recommend targeted spinal injections, not just for treatment, but also as a diagnostic tool. The good news is that the vast majority of patients with isolated neck pain, meaning pain without neurologic symptoms, will get better with non-surgical treatment. Surgery is rarely the first answer. We typically start with a short period of rest, followed by physical therapy. Physical therapy is one of our most effective tools. It strengthens the muscles around the neck, improves posture and endurance, and can significantly reduce pain over time. For medications, over-the-counter options like acetaminophen or Tylenol and anti-inflammatories like ibuprofen or naproxen are commonly used and readily available. Anti-inflammatories in particular can take a few weeks to fully kick in, so it is important to be patient and give them time. Prescription muscle relaxants or a short course of oral steroids, like prednisone, can also help in some cases, though they require careful management. I want to be clear about one thing. Opioid pain medications are generally not recommended for neck pain management.
Do things like chiropractic care and acupuncture have a role in the treatment of neck pain?
Both are definitely options some patients pursue. Chiropractic manipulation is generally safe, but I want patients to be aware that rare but serious complications have been reported with certain types of manipulations, so it's worth having a conversation with your care team. Acupuncture is still being studied. While it appears to be safe and often effective, the research definitely hasn't proven exactly how it works.
Is surgery ever necessary for neck pain?
Surgery is rarely needed for isolated neck pain. That is, the kind of neck pain without nerve symptoms. When it is considered, it's usually because of a specific circumstance, such as a tumor or infection, certain types of fractures, a significant deformity, instabilities, inflammatory conditions, or a previously failed fusion that needs a revision. Here's something important to understand. Historically, spine surgery performed purely for degenerative neck pain, without any nerve involvement, has had a low success rate. Many patients don't get adequate relief, and some don't improve at all. So for most people with isolated degenerative neck pain, even if conservative treatment hasn't fully worked, surgery is still generally not the recommended path. However, and I can't stress this enough, if your neck pain comes with neurological symptoms like arm pain, weakness, or balance problems, that changes the picture significantly. Conditions like cervical radiculopathy or cervical myelopathy may require and benefit greatly from surgical treatment. Those are separate topics we'd encourage you to learn more about through other patient education materials.
Dr. Heller, thank you so much. This has been incredibly helpful. Neck pain can feel overwhelming, but as you've heard, There are clear paths forward for most individuals, and most individuals improve. The key is understanding your specific situation, working closely with your doctor, and knowing the right questions to ask. If you'd like to learn more, please visit csrs.org for additional patient education resources. And as always, speak directly with your own doctor for advice tailored for your specific individual case.